Hello, good morning everyone. Myself Dr. Pranita Patil. I am here to introduce Tanvir Hussain Sir, but I'll take a great honor to welcome our dignitaries who have joined. So I'll name the few: Dr. Organon Philosophy Sir, Dr. F.F. Motiwala Sir, Dr. A.S. Man Sir, and Dr. Tanvir Hussain Sir. Thank you, sir. Thank you, everyone.
Tanvir, can you hear me?
Dr. Jaswant Patil, sir. Welcome, sir.
Tanvir, can you hear us? Tanvir? Dr. Tanvir? Okay. Till the time Dr. Tanvir, yes, Tanvir. Tanvir started. Tanvir, sir.
It gives me an immense pleasure to introduce today another eloquent speaker, Dr. Tanvir Hussain Sir. Sir is the National President of IIHP, Indian Institute of Homeopathic Physicians. Sir is the only homeopath in the India who has done MD in 3 subjects: Materia Medica, Organon Medicine, and Repertory. Sir is an author of book 50 millisimal Potency, a silent and showering spring. Sir has received more than 25 awards in seminars in state, national, and international seminars. Dr. Ellen Khan Sir says Dr. Tanvir is a Sachin Tendulkar of homeopathy. Friends, Sir has so many achievements that I can just keep talking about, but time will fall short. So without wasting much time, I request Tanvir Hussain Sir to please take over. Friends, let's welcome Sir with huge round of applause.
Welcome, sir.
Welcome, Tanvir, right?
Thank you very much, Dr. Pranita, for this gentle introduction. First of all, good morning, Dr. Arun Bhasmeji, Dr. Neelam Avtar, Dr. A.S. Man Singh ji, and all stalwarts today. I am so happy. I have just joined the later part of Dr. Neelam Avtar's lecture. She is doing very wonderful job, Liaquat, in Punjab, IHP, Punjab State Branch. I am reading the regular inputs and explanations of mental rubrics from Dr. Neelam Avtar. Hats off to you, ma'am. Really, you are doing very great job, because it is a need of the hour to educate, to give the right path, or to show the right path, especially to the neophytes. So it is the regular effort of Dr. Neelam, wherever she is, maybe in India, maybe in the flight, maybe in US, anywhere. She is not missing a single day to post her rubrics. Thank you very much for this, for working for homeopathy. I can say you are working for homeopathy. This is the need of the time, that everybody should be like Dr. Neelam Avtar, servicing students and homeopathy in particular. So, Liaquat bhai, assalamu alaikum, good morning to everyone.
Walaikum salam. Your friend, Tanvir bhai, my Guruji, Dr. Arun Bhasme Sir, and Dr. Motiwala Sir, both are there.
Motiwala Sir, hello sir.
Yes,
where is
he's
Dr.
also there.
Motiwala Sir?
And Jaswant is also there. Dr. Jaswant Patil also is there.
Jaswant Patil from Pune.
Yeah, from Bombay, especially he has joined your lecture because he wants to learn about. He wants to learn about
yes.
Ellen Potency. Yeah, Jaswant is also there.
Dr. Patil sir, good morning. Dr. Patil has written some few words about my second edition of my book. He has given some his remarks. Farooq Motiwala sir, good morning. And now I thank the whole team of Dr. Liaquat's association for organizing such a wonderful event today after completion of their 100 webinars in general. And in particular, I especially thank Dr. Liaquat for inviting me and giving me this opportunity to be with you regarding my earlier topic, 50 millisimal potencies. Starting this 50 millisimal potencies, one thing I can tell you, where Dr. Neelam Avtar has just said, it was very important line she quoted, that sometimes we fail to achieve the results just because of the mismatching of the potency, just because of the inappropriate dosage of the medicines when we give to the patients. Dr. Hahnemann has faced the same problem when he was first time, joined as a homeopath in Dessau. It's in a place near Koyathin. When he started giving his before homeopathy he has joined. He has started giving allopathic medicines to the patients, and he found the severe aggravations. Then he left the practice and said that I cannot do this criminal kind of murderous kind of practice. He used the word murderous, murder. He is doing murder with the patients. So he left the practice and in search of homeopathy. Then we know that how he found and discovered this wonderful science. And again, the whole life of Dr. Hahnemann, he has spent to minimize the patient's aggravations, to minimize the aggravations of patient's complaints, because he was a doctor, allopathic doctor. He was treating the patient, but he was a scientific bent of mind of the person who was a very kind-hearted, who felt that I should not, bother my patients further. So, if we start the evolution of potencies, starting from pre-homeopathic era, then post-homeopathic era till his death.
Tanvir bhai, Dr. Sanjay Sahgal sir is also joined.
Sanjay sir ji, good morning, sir. He is the teacher of the teachers. Sir, warm welcome to you. It's an honor for me to speak among all these dignitaries today morning. It's very wonderful time. So, Dr. Hahnemann had started from the crude substances, then he started using the part of the crude substances. In the beginning, he started using the medicine in grams quantity. Then he slowly reduced the amount of the medicines. And finally, in 1821, he started using the globules. Why so? Because he found that even a drop of the medicine is not, right or appropriate to prescribe to the medicine. Dr. Liaquat, I want to draw the attention of all those homeopaths who now also practice the way that when patient comes to them, they say to the patient, please open your mouth, and they pour some drops of the medicine directly over the tongue. So in this way, because, one drop of any potency is a very large dose. So Dr. Hahnemann, what he did, he wrote in his Organon of Medicine. I'm telling you, Organon of Medicine is the fundamental of homeopathy. It's an unquestionable authority in homeopathy. Unquestionable authority, I'm telling you. And I am responsible for what I am telling you. See, he wrote in 4th edition of Organon in 283 aphorism that a mere one drop is a large dose to most of the patients, which causes much harm than the benefit. So he said that I now take 300 globules of poppy seed size globules, and I imbibe the medicine in those 300 globules, and I take only one globule out of them. It was a significant decrease in the dose, in the quantity of the medicine. Okay, so I'm talking about 4th edition of Organon, which was published in 1829. Just I'm taking back to you the whole journey of the LM potency. If you are with me, then you will be definitely at the end of this talk will appreciate Dr. Hahnemann, how beautifully he was successful to introduce this LM potency, and what was the need to introduce these LM potencies. So in 1829, he says you take only one globule and place it dry on the tongue. And in the same edition, 4th edition of Organon, which is not easily available now, and I am telling you, friends, whatever I'm speaking today, I have trodden upon a long journey in the pursuit of LM potencies. Just to understand what is LM potencies, I have made 6 visits to Germany, also various countries, including my this one. So he says in the 283 footnote that only one globule is sufficient. Again, he says in the same edition, 4th edition only, in 284, 286 aphorism that now we should dissolve the medicine, dissolve the globule in water and give the solution form. So it was the journey of, again in 1829, after 1829 or 1830-31, when he was in Coethin, he started prescribing the medicines in olfaction method. Olfaction methods means he used to take medicine in alcohol form, and 50% water, 50% of the medicinal solution he used to give to the patient to just take one breath. It was one dose for those patients who were very hypersensitive. He said this is the mild dose and you can treat the patients with this method. I am practicing this olfaction method in most of the hypersensitive cases where it is very much required. And I'm telling you one more practical tip here. When patient comes to us with, suppose a fever patient comes to us and he is a Persitilla patient, or He is arsenicum patient where thirst is very important. So in LM potency, when we prescribe the medicines frequently in water, then we cannot judge the thirst of the patient. So suppose I am giving the instructions to my patient to take my dose every 1 hour or every 2 hours or 15-20 minutes in acute cases. So the thirst part of the patient we cannot judge because we are giving the water in our medicinal form. So in those cases also I try to prescribe my medicine in olfaction method with this olfaction method. And now when 1829 came, some of his followers, especially Mr. Korsakov, who was from Russia, he is father of homeopathy in Russia. He started using or preparing the medicines in higher potencies like 150, 500, 1500. So Dr. Hahnemann has written a warning letter to two of his disciples, including Dr. Mr. Korsakov, that from now onwards you should standardize your potency and dosage. And it was 30 potency. Friends, why I am telling you that most of the people, even today, they are very satisfied and very happy to prescribe 30 potency, because once upon a time, Dr. Hahnemann says that you should give 30 potency to every case of your patient. 30 potency. It was standardized. Dr. Hahnemann has written one letter in 1829 to Dr. Mr. Korsakov and to one of his own another friend. So it was a story of 1829. Now comes 1833 when he came up with his 5th edition of Organon. Because if you want to understand the evolution of LM potency, then you should understand the mindset of Dr. Hahnemann from 4th edition, 5th edition, and in between the chronic diseases, which was published in 1837, then finally 1843, this last edition, which was published in 1921 or 2. So in 5th edition of Organon, what changes he made was, in 4th edition, he says you should give one single dose of a medicine and wait and watch. As long as the action of the medicine is going on, you should not give any medicine to the patient, either the same medicine or the higher potency of the same medicine. So he said it is totally prohibited until or unless there is definitely relapse of the symptoms. So in aphorism 245 and 246, Dr. Hahnemann says that you should not repeat the potency or the dose as long as there is definite action of the medicine is going on. So you should keep your hands off. This is known as wait and watch method. It is very, very important because maximum of our homeopaths, they are even today, they are practicing in the same method, that they give single dry dose on the tongue and with the placebos and send the patient. And when patient comes with the follow-ups, they ask every time, how is your condition? How is your health now? Patient comes and says, doctor, I am feeling better. We prescribe again placebo. And we can keep on giving placebos as long as patient is improving. When patient comes with us with a status quo or with that relapse of the symptoms with which he came to us earlier, then we give the higher potency or the same potency of the medicine. This is what Dr. Hahnemann has taught us in 4th edition. So wait and watch method belongs to 4th edition, which Dr. Hahnemann wrote in 1829. So please note down the things, because now we are going to the next step. But in 1833, when he came with the 5th edition, he found that most of the patients in acute conditions, he was able to do with this methodology, which he prescribed or which he instructed or recommended in 4th edition. But in chronic cases, he found that many patients, they are not giving the result as quickly as it was desired. For example, any case of arthritis, any case of chronic disease, when Dr. Hahnemann used to prescribe single medicine, patient was not responding in that way. So he said in 5th edition, if you read the longest footnote, 246 aphorism footnote, Hahnemann says that in those conditions, in those chronic conditions where the cure is not, the result or response of the patient is not coming as per the need, then you should give the medicine at appropriate intervals. Every 7th day, every 10th day, he said that you should prescribe the medicine of the same medicine, for example. I was attending
10:30.
I was attending one seminar in Hyderabad, and doctor was prescribing lycopodium 30 every 15 days or every one week. Though the patient was improving, I asked, why are you repeating the dose when the patient is improving? He said, I don't know. But when I read this footnote, then I came to know that many of the stalwarts, they took the gem of Dr. Honeyman from 246 footnote to understand that yes, we should repeat the dose at appropriate intervals. Maybe if it is 30 potency every week or 200 potency maybe after 15 days, though the patient is improving but slowly improving. Now Dr. Honeyman has given some liberty to us that you can or you should prescribe in those cases where the improvement is a little slow one, right? And in that same edition only, he said regarding this olfaction method, he has given in very much detail. And he said that the medicine should be now, every medicine should be dissolved in the liquid form, which many people, they are not still following. And later on, in 1837, Dr. Honeyman started experimenting because until 1834, he was in Coitin. In 1835, he moved to Paris along with his second wife, Madame Melanie de Harville. In the Paris state, the pace of life was very, very fast, and everybody was, in hurry that you should give the medicine which should be acting very quickly. So Dr. Honeyman revised his 5th edition of Organon, and he started thinking that why my patients are not getting quick results, because he has written in his second aphorism of his 5th edition of Organon, the ideal cure should be rapid and gentle. It should be rapid as well as gentle. So rapidity was not available in most of the cases. Then Dr. Honeyman says that I should revise my posology. Then he started giving the dosage in frequent, intervals. For example, 1837, if you read the 3rd volume of Chronic Disease, the preface of this book, I can show you the book, The Chronic Disease. If you see this, in the very preface only, Dr. Honeyman says that you now take 1 globule. This is the preface to the 3rd volume. Dr. Honeyman says in every case, you take 1 globule, dissolve it in tumbler full of water, make the spoonful doses and give to the patient frequently. In chronic cases, he says you can prescribe daily or on alternate days. In acute conditions, 2 to 6 hourly. And in severe or urgent cases, you can give it more frequently also. So in 1837, he had recommended that we should prescribe the medicine more frequently if it is necessary, minded. So slowly, this methodology which he started experimenting with the centesimal potencies, later on he converted into 50 millisimal potencies. Now in LM potency, what he made, what the changes he made were, number 1, in every successive potency of 50 millisimal potency, 50 millisimal scale, the dose is lesser in quantity by 50,000th time. For example, if we see in centesimal scale, it is 1:99 or 1:100 potency scale. In LM potency, it is 1:50,000 times. So we can see that the quantity of the medicine or material part was highly reduced, but at the same time, the number of succussions he has increased to the 10 times more. Because to prepare centesimal potency, we used to give 10 succussions, but when we are preparing 50 millisimal potencies, we give 100 succussions. So to make it more dynamized, he started giving 100 succussions because the medicine should be more penetrating and it should be more dynamized. But at the same time, it should be milder one. The milder one quantity he gained from the dilution part, 1:50,000 part, and the more penetration of the medicine he gained from the more succussion part. So succussion, number of succussion is also very, very important. So now Dr. Honeyman says that in 6th edition, footnote, he says that whatever I have said in the 5th edition to the long footnote to this paragraph, he is talking of 246 footnote in 6th edition. He says whatever I have said in the 5th edition to the long footnote to this paragraph was my experience of that time. That time means in 1833. Now, in the past few years, I have overcome all the difficulties of undue aggravations of my patients' complaints. That is the aggravation part of the patient's complaints. He said that I have almost covered, and this methodology is the perfected one. It is the most perfected one. It's a new dynamization method. So it was all about a small summary of the evolution of the LM potencies. I have explained in detail in the last lecture when Dr. Jakat he has invited me. I now go to the host. If you have any queries regarding 50 millisimal potencies or any question directly, you can ask me so that we can clear the doubts of the audience. Dr. Patil? Hello?
Yes, sir. Yes, sir.
Am I audible?
Yes, sir. You are audible. Sir,
did you get any question or can you ask to anybody? I think Dr. Jaswant Patil sir wants to say something. Yes. Bottle chak liya मेरी
Mute.
bottle. Sorry.
It was muted as not getting. So
Sir, please.
thank you, Tanvir, for enlightening us on such a very my interesting topic. I've used very rarely because I'm a person from the material doses. So, but I have seen your cases and they were really impressing how it can happen. And it has really opened my insight. We all learn from each other and we should be open to all the methods. And I started using after talking to you. I called you also.
Yes, sir.
I called Liaquat Bhai also. He is my brother and very close to my heart. Both of you are doing a wonderful job on your potencies and very small potencies. I'm very much happy the way you have in a short brief told about the LM potency. Now every day I'm getting open and open with the LM potencies. And I've seen your case presentation in Agra when we were together there.
Yes,
It was
sir,
really
yes.
good. I've seen the case presentation of Liaquat Bhai. And I was, means 4 5 times I joined his Thursday classes. They were wonderful. Huh? Mastabeki enjoying and teaching student. His way of teaching is also very excellent. And same way is, and Madam Neelam is there. And I'm a fan of her. She is every time I open any WhatsApp group, Neelam Madam is there. And she has done a very beautiful representation. Very short, sweet, and understanding to the point. So we are there with so good homeopaths, and we should be proud of homeopathy. Whatever way anyone accepts and goes, final mission of the physician is to cure the sick. That is what Dr. Hahnemann says. And dare to be wise, or sapien. We say, but we don't dare to be wise because every case is different. 5 figures are different. The way one has to approach, the Trump way we should go. But
yes, one Tanvir Sir's lecture on LM potency is there of 1.5 hours total on YouTube. मैं तेरे को उसका personal link भेजता हूँ.
yes, thank you.
He has taken extensive, very deep lecture on LM potency.
No, he is a great
in this 100 lecture seminar. And
I have written a preface also for his book.
Yeah.
Yes, this is the first edition, and I am coming up with my second edition soon.
Yeah, it's really good, and it should enlighten everyone on this. See, the knowledge kept in the book remains forever.
Yeah.
Yes,
We
sir.
are perishable. The knowledge is not perishable. So we must always contribute.
Yeah.
Whatever experiences everyone has,
Yeah.
rather than criticizing each other, contribute.
You know, Dr.
Hahnemann also has.
Dr. Ambedkar once said, if you want to talk to the person, read his book. So if you are reading Tanvir, you are talking to doctor. If you are reading Organon, it is as if Dr. Hahnemann is speaking to you.
Yes.
Yes,
100%.
of course.
Yeah. So I am very
The
sorry.
organon of medicine, I used to say that it is organon of medicine is lifeline of homeopathy. We cannot ignore it any time.
Yes.
If you find any problem, go to organon.
No, you should
If
not. You cannot be. You shouldn't. Nobody should ignor that.
Dr.
Always, I
also.
always keep this with me.
Yeah.
If I find any problem, I always go to special, aphorism, and we can get the answer to every question. I always knock the door of Organon Hahnemann.
Yes, my dear brothers.
You
Brothers,
are-
I have to stop you. I am very sorry to stop you both for a moment. I'm feeling like a TV anchor now that I have to stop you in between. Dr. Basme sir and Dr. Motiwala sir and all other dignitaries.